Okay, so well, before we get started with like the really hardcore questions, we'll ask you like the basic questions. So, what's your name and where are you from?
Okay. I'm Elaine Caplan, and I'm originally from Houston, Texas.
Um,
Story
so
goes on.
do you want to go, Nick?
Okay. So we heard that you went to UT too. So what was your official major while you went to UT?
My official major was biology. Actually, ended up with a BA in biology, but I was a pre-vet at the same time,
Oh,
doing
that's
all the
good.
pre-vet
Yeah.
courses. Yeah.
Like you.
Yeah. And you, Josh?
Do you think your undergraduate studies has been helpful in a practical way, or has it just been like a foundation?
Well, I would say both ways, because I think it's definitely a foundation, because first of all, you have to have all these courses to get into vet school. Then once you get into vet school, you're doing obviously more science courses, and you hope that you've got a good base, so it won't, you can easily kind of make it through those courses. And I think University of Texas science courses were challenging enough to where it was excellent for pre-vet, pre-med, or whatever. So yeah, on a practical basis, it just seems like, because I have done a lot of post-veterinary training, and I don't know if that's going to be one of your questions, but so even when it comes down to practice, or doing clinical work, which is most of what I do, you've got to have a lot of basics, and even stuff like, you think, okay, physics, for instance, or I don't know if that's usually a pre-med, pre-vet course, or organic chemistry and all these things. They come back. It always comes back. It comes back in pharmacology. It comes back, we do radiation therapy here, so physics is huge in that. So that it keeps coming back. And then you use these. Even to practice every day. But it is the basis. You're right. It's kind of like it's where everything else is built from. So yeah.
So, as a follow-up, how well do you think your graduate studies helped you for the work environment?
My graduate studies.
Yeah.
Yeah. Well, I did my did my vet school at Texas A&M. I did an internship in small animal medicine and surgery in New York City at the Animal Medical Center, which was it's a big, huge veterinary hospital with lots of specialists and such. And then an internship, and then residency, which was just in surgery. And I did a surgical oncology fellowship at University of Illinois. And interspersed in this was, working in clinical practice too. And what was your question?
So, do you feel like it prepared you for the work environment?
For the work environment, my graduate studies. You know what, I think it was almost kind of like undergraduate, because it gave you the basis, because when I went through vet school, we had to learn. It wasn't just tracks where you go, okay, I'm going to go small animal track or large animal or equine. It was a little bit of everything. So, which got me ready for, to pass the national boards and things like that. And, we were able to see, when I went to vet school, we were able to do spays and neuters and things like that, but now they don't really do so much of that anymore. So that gave me some practical work, to working with my hands and getting my hands wet, so to speak. So it kind of got me ready, but I felt that when I graduated, the day I graduated vet school, I thought, I don't know anything, I pretty much thought that when I graduated. But you realize that you do have something, but then you get on to the next stage of working, doing an, like for my case, doing an internship, and then you just keep, fine tuning it and learning more and experiencing more so that you can, start learning how to be a doctor, actually seeing patients and talking to owners and learning how to think. I think that's where I learned how to think, and, so every time I went to a different, level, I think it added, to my confidence and competence, I guess, best way to put it.
I see.
I hope that answered your question.
Yes, it did. Thank you.
So, for my question, what do you think, or how much animal-related experience did you have prior to applying to vet school as an undergraduate?
Okay, well, this will make you laugh. At that time, I was trying to get a job in a veterinary hospital in Austin, and that was pretty much near to impossible. I think the only job I was able to get is like a Saturday morning for 3 hours being an assistant, maybe a kennel person, I'm not really sure, or receptionist. I remember doing some of that at a vet hospital here. And then it was kind of irregular. And then the only thing I could find at the time in Houston, pre-vet, was I think I worked at a pet hotel. But then once I went through my first application of vet school and I didn't get accepted, I realized, and I had finished most of my, my work for my BA, my biology degree. I just had to move to Houston, and I worked for the vet hospital that I grew up in, and turned out that they had a surgeon there that had just come from New York City getting his training in surgery, and I got to be his technician. And he was he's really good at what he did, and I just worked full time as his technician, and then after that he wrote me a recommendation, and I think that made all the difference that year. So I got in the second time around.
Yeah. Nikki?
So a lot of freshmen are still unsure if they want to take what they're studying and turn it into a career in the medical field. What advice would you give to a freshman that doesn't know if they want to be in the medical field or not?
That's an excellent question, because you can be the kind of person that, well, I'm not even sure if I want to be in the medical field, or somebody like me that has had like this dream of being a vet since I was 7 years old, and I was just, bound and determined to do this. But a lot of my friends who were graduated vet school, and they just decided while they were in undergrad that they wanted to be pre-vet or pre-med or whatever. And I think that most people, the best thing to do is to somehow, even if it's just volunteering somewhere, to spend time with, if you want to be an MD with somewhere in medicine, in a hospital, or just wherever you can get your foot in the door, in veterinary medicine, just even if it's scrubbing cages in a vet hospital, because you just really don't know what you're getting into till you actually are witnessing it, and you're in the thick of it, and you get to talk to people who really are in it, and have gone through the school, and they're what they're actually doing, and what are all the options that are out there for you to do with that field. Yeah, I think the medical field is, there's so much so many options, and you could immerse yourself in some specialty that'll take another 10-15 years to get, and may take up all your time, and maybe a little bit difficult for people that are just wanting to get out of school and just start doing what they do after 4 years or say 6 years. But there's a lot of professions out there that nursing, or physician's assistants, or rehab, physical therapy, or in radiology or ultrasonography, that you actually you don't have to go to, you could get a great job, and has benefits and vacations and things like that, and have a life. You actually you work in, you actually do leave at 5 o'clock every day. Sometimes you don't leave work on weekends, so that's why it's a good idea to really find out, and explore, talk to people, or try to, volunteer or something somewhere. Sometimes that's not easy.
Yeah.
Did that answer your question?
Yeah, definitely. Thank you.
Okay.
What was something that surprised you when you started your profession as a vet?
What surprised me was, well, at first was not, I didn't feel real confident at first, and so, that was more frustrating than anything else, because I just felt like, okay, I gotta, hopefully, that's why I did my internship, because there was a huge caseload, and I had a lot of specialists around me, and I learned how to think through cases and stuff like that. So, and then the other thing is, I did my internship non-paid. I did a non-paid internship, so I ended up, borrowing money so that I could, do that. So I think that's, and unfortunately I don't have the issues that a lot of people have now with, how much it costs to go through that education. And so many people that I know that are, just getting out now, or in the last several years, are just having to deal with, with paying back their education. So I know that I think would be, it wasn't particularly my problem. I did have some debt, but not what I'm seeing with people now. Anyway, yeah, you don't make, sometimes, although I think in my field, coming out of vet school, they are being offered some reasonable salaries, but when you're faced with, God knows how many, I don't even know how much it costs these days, a couple $100,000 in debt, or I'm not sure. Maybe I'm just guessing all that. But, it's just that would, to me, be a big surprise, like, oh man, now I gotta pay this back, and, get a job and do everything. So that's a good thing to take in consideration when you're deciding on, you're not sure what you want to go into, just making sure that, you're going to be able to make a decent salary at the end.
So we know that today was a very stressful day for you, but and so in times of stress and pressure, how would you usually help yourself overcome these times? Or?
Yeah, that is probably one of the most important things to consider, because veterinarians and dentists and there are certain professions that are they're just high stress, and sometimes it's just relentless. It's not like you can just, you can't just take breaks all the time and everything, and things can get pretty intense. And so I do a lot of breathing. I make myself go outside and, sit down and, look at the sky or whatever it is that, you do to just kind of take it down a few notches. So that's, I think, and then when I'm not working, I try to be having fun, just whatever that is, just having fun. I try to exercise, I try to keep exercise, exercise is real important to me. And, reading trash novels are great for me for relaxation, going online and just messing around, watching TV, doing, not too cerebral things, just really kind of just chilling out, basically. Having friends, making sure you take care of your friends and keep your connections with your family and everything else, because you have a support. Everybody tends to have their support, they're out there, so you can vent. It doesn't change, you know.
Yeah, definitely. Do you want me to close with one more question? Or?
Yeah, sure.
Okay. So,
I have one more.
oh,
Okay.
do you want? You can go.
Okay,
Go
go.
ahead.
Oh, okay.
Yeah.
Have you ever had any doubts of becoming a vet?
You know, probably about now. You'll have to understand. I am now. Let's see. I'm like 36 years into this. Okay. Probably when I was in my 30s. You know, so I graduated when I was 26 years old from vet school. So I started thinking, well, maybe I ought to go to med school. You know, maybe I made the wrong decision, and then I just, you know. Because I didn't think I was making very much money. I mean, but I really love working with animals, so that really doesn't change. It's just that, you know, reality kicks in a little bit. But that was a long time ago. We're talking about in the Stone Age of the 1980s, or no, yeah, early 90s. But you know, now, but really, I finally came to the point where I was pretty happy, you know, waking up every day and. You know, another bunch of challenges and never dull moment. Yeah.
So you wouldn't change anything?
No, because I really, I made all my goals, and a lot of them were professionally related. You know, so I'm a boarded surgeon, and I'm a surgical oncologist, and I started this practice in 2002, and I sold it 3 years ago, so I'm kind of like, check, did that. And so now I'm just enjoying being a surgeon and a doctor and not having to have other responsibilities. So yeah, I'm pretty happy where I'm at with everything.
So, sorry, I have one more follow-up question.
Yeah.
What would you say is the most rewarding part about being a veterinarian?
I think the most rewarding part is when I have clients, you know, because people come to see me, they've got really tough, their animals have tough diseases, and the most rewarding thing is to, you know, talk them to examine the dog and come up with what, you know, what's going on, or maybe they already know what's going on, and making them understand what all their choices are, and what, say for me, what the surgical thing would be, and you know, all the potential complications, and so that they are educated, and you know what I mean, they understand, they can make an educated decision, and they feel confident about their decision, and that I've answered all of their questions. And then when I do the surgery and the dog is better, that's the best thing ever.
Yeah.
That's the best ever. So yeah, I like it.
So, you guys all get on questions?
Did you have another one?
Yeah, just one quick one. It's similar to Denise's here. So, your career is really, really important. Like you said, people love their dogs, and it's really rewarding when you can help them heal. What's the most valuable thing that you've learned just in your career?
Most valuable thing, persistence. Persistence, yeah. Well, I'm very, probably like you guys, I'm very goal-oriented, which, you know, so that puts me into some situations where, you know, I may not be, you know, and to also, and this reminds me because of my earliest days of you know, being in training for an internship. And I'd be all upset because I wasn't going to become smart enough, and I was, you know, this, that, and the other. And my mentor in surgery said, okay, you're going to have to stop all that stuff, you know, because there's always going to be somebody smarter than you, and there's always going to be somebody that doesn't know as much